Welcome to your knee replacement education video. Thank you for trusting Optimotion Orthopaedics with your knee surgery. When it comes to knee replacement, our surgeons at Optimotion Orthopaedics use a minimally invasive lateral approach. Pictured on the left is the traditional knee replacement approach. The incision is in the middle and cuts through the quadriceps muscle. Pictured on the right is a lateral side approach, which is used by our Optimotion surgeons. When compared to the traditional method, this lateral approach has several benefits, which include less postoperative pain, less blood loss during surgery, rapid return of knee function, faster recovery, and avoidance of cutting into major muscles and ligaments. The Optimotion lateral approach allows patients to walk on the day of surgery. Overall, you will be able to resume activities of daily living in a shorter amount of time. Please turn to page 3 of the knee handbook. This must-do checklist will take you through the steps that need to be completed in the weeks leading up to your surgery date. Failure to comply with these steps may cause a delay in your surgery date. Before surgery, you must see your doctor for medical clearance and testing. Please make an appointment to see your doctor as soon as possible. The medical clearance appointment with your primary care doctor must be scheduled within 60 days of the surgery date. The following is due in our office 3 weeks prior to surgery. 1. Medical clearance form signed by your primary care physician. 2. Office notes from the primary care physician. 3. Labs must be within 60 days of surgery. 4. EKG must be within 6 months of surgery. If required, you may need to see a specialist for further medical clearance. The specialist clearance appointment can be made within 6 months prior to surgery. The following is due in our office 3 weeks prior to surgery. 1. Medical clearance form signed by your specialist. 2. Office notes from your specialist's office. 3. Any other testing ordered by a specialist. Please request your doctors to fax these items to our office. We strongly recommend that you obtain a copy of your medical clearance for yourself in case we have any difficulty obtaining them from your doctors. Your surgery will be postponed if not received 3 weeks in advance. Please turn to page 4 of your knee handbook. These are a list of medications that need to be stopped prior to your surgery. Please inform your primary care doctor and any prescribing physicians of the medications that need to be stopped. 1 month before and after surgery, stop taking steroid medication and certain immunosuppressants. 2 weeks prior to surgery, stop taking the following medications: all antibiotics, painkillers, all diet weight loss medications, all vitamins, and all herbal supplements. Tylenol is a pain reliever that may be taken up until the day before surgery. 7 days prior to surgery, stop taking all medication that can increase bleeding. This includes aspirin, Aleve, Advil, anti-inflammatories, ibuprofen, and Motrin. Our protocol requires you to stop taking blood thinners 7 days before surgery. 48 hours before surgery, you must stop taking metformin. You cannot restart taking any anti-inflammatories until you have been given specific clearance by the surgeon. If you have any questions regarding medication that is not specifically indicated on this form, please speak with your prescribing doctor and follow their recommendation on when you need to stop the medication. Following the instructions in the packet is required in order to prevent any delays in your surgery date. This is the end of the knee educational video. Please return up to the front desk and let them know you are finished watching the video. They will set you up to speak with the surgery coordinator, who will choose a surgery date with you and answer any questions you may have. Thank you and have a wonderful day.